the hospital. We are going to reduce the waiting time because our theatre is now well equipped to operate many patients. We have now 2 operating theatres with 2 analgesic machines, 2 theatre lights, and other equipment that are equipped with that monitor. And these are going to reduce the waiting time for the patients. We used to refer patients before because of these equipment were not available with 2 complicated surgeries. Now we are able to do these complicated surgeries courtesy of the place equipment. And as we're going to operate, we're going to see more patients flowing. We're going to see quality of care increasing. And this is good for patients in the county as well as the surrounding county. So we thank the county government for sending into this equipment that are going to help our patients like that. We freed the machines that we had, and now we equipped the other theatre in the maternity wing, so that now we have 4 working theatres. And this is very good for our patients. Thank you.
Improving the care of the patient that we get. And one very important thing that we thought about when receiving the equipment is the safety of the patient. Because when you go to the theatre, it's not about just going in and coming out. The safety features of this equipment is quite top-notch, from the anesthesia machine, which is able to ensure that at no given point the patient can get gases that don't have enough oxygen, from the monitor that is able to monitor advanced features which you are not able to monitor before, and therefore at some points you need to refer patients that needed such extensive monitoring. But this is a monitor that now can help us do extensive surgeries and the most complicated surgeries whenever we need them. We've also been able to have quite a complex number of patients coming in. With the advancement of the level of the hospital, we're getting critical patients who require surgery. And these critical patients who require surgery also need quite specific dosage of drugs that they get, sometimes very low volumes, sometimes very high volumes, which was not quite practical without some equipments. But we have received these equipments which will be able to help us give safely and accurately these small volumes, and also when we need to give high volumes of drugs within specified time, we are able to do that. And therefore, by receiving this equipment, the safety and the quality of care that we give to our patients will drastically improve, and therefore we are able to handle quite complex patients getting good outcomes. We want to thank the government of Makueni that has enabled us to receive this. By receiving this, the people of Makueni will add immense benefit of the outcome that they will be receiving.
Known as MES. So in this case where the patients come to the hospital, once they are treated, the SHA is able to pay and reimburse. And in terms of the quality of the machines, we have received really the top-notch machines, and as explained by the experts, these machines will ensure that we improve quality of care. We have an advantage in Makueni of having very well-trained doctors, consultants and specialists. What they were lacking were tools. And we now can say safely that we have 4 operating theatres. We had, if you recall, when we had the outreach where we had surgeons in Makueni last year, we could not move the patients very quickly. In fact, after the 1 week of surgical camp, some patients were to be operated much later because of the lack of this independent theatres. Now Makueni is truly a referral center. It's truly a hospital where we can handle anything because we have made sure that they have adequate power, renewable energy, we have the blood center, we have the experts trained and they are back, and the technology. So we can safely say that Makueni is leading in matters healthcare because of the equipment we have seen. Matters X-ray, again, we have very advanced equipment that will ensure that we can handle as many cases as possible. we are handling up to a minimum of 70 to 80 cases a day. And with this new machine, you can do even more than 100. And therefore, it's a good program, the national program on the equipment, and we have taken advantage of it, because the biggest headache for counties today, is procuring these machines. The resources we have are not adequate to ensure that we can purchase these machines. The national program on placement of these machines will enable us to do the most complicated, and we don't need to refer anybody from Makueni County level 5 to anywhere in the country, because we have everything that we need. We have a very advanced machine for the conduct of neurosurgery. We have the nephrologist, Mr. Solomon. We have the neurosurgeon, Dr. Mudoka. And I can tell you, even Kenyatta National Hospital is going to envy us